We have another wonderful speaker. She was here yesterday. Big hand for Leah Bisiani, registered nurse. And Leah, tell us a little, what we're going to do is we're going to just have a little chat, and perhaps we can have some more specific medical questions from the audience. And we are actually very knowledgeable people, so we'll be able to fine-tune your answers and questions. Okay? So feel free to get some meal, eat, drink here, listen, just be sociable.
Don't leave.
You don't all run away yet, but come back.
I'm talking about aged care.
Aged care.
You're old people.
All right. So Leah, introduce yourself.
Hi, my name's Leah Bisiani. I was here yesterday talking about chronic pain in aged care and looking at the current landscape, which is quite a critical area of need. So I'm a registered nurse, Div 1. With my Masters in Health Science, and I'm an aged care and dementia consultant. So I've worked in aged care for 35 years, so it has been my life's work, and I'm now lending my reputation to the revolution of actually advocating for alternative approaches to chronic pain in aged care. So what do you want me to say now?
Well, Leah, I read this study by a nurse or a doctor in America, and she was looking after children, actually.
Yeah.
But it applies to everyone here, adults. She found that she could reduce the opioid, the morphine content that you're taking for pain relief as a child. You know, they either cry or they don't, right? By 80%. Simply by introducing CBD. So my question to you is, have you noted anybody in healthcare having less opioids, perhaps by taking cannabis?
No, the regulations these days aren't really allowing us to overcome that hurdle just yet in residential aged care. So people that are living in residential aged care suffering from chronic pain are not actually having CBD administered in any way as yet.
What's your take on it?
Gross neglect on a grand scale. Basically, when we're looking at the amount of elderly people that have pain associated with most of the conditions that they live with on a daily basis, I did a study last year that was published in the Journal of Pharmacy Practice and Research, and what we identified was that of all the people in residential aged care that are on opioid regimes and the huge amount of other medications they need to counteract the actual side effects of the opioids, which we're looking at huge polypharmacy here, which destroys quality of life anyway. But in 73% of those cases, they're not having their pain managed effectively. So these people are living feasibly for decades with chronic, relentless, debilitating, excruciating pain every single minute of every single day. So therefore, there's a huge need for an alternative approach, and enough with the bureaucratic bullshit, enough with the intentional barriers that are actually in place in regards to not alleviating the suffering of our older population. So hence I've got on the bandwagon here, and because of the data that we collected with our research, we're advocating that there is an alternative approach, and so we've identified the problem. We're also giving them the solution, which is looking at medicinal cannabis as a real viable and beneficial option. There's enough evidence out there anyway to suggest that this is going to be a great way forward in modern medicine. So it's about time everybody work together, which means not only the politicians, which are really a huge hurdle, but our medical professionals, because I work in the medical field and I have a lot of respect for our doctors, but we need to arm them with knowledge and skills so that they can prescribe confidently to the people they're caring for, because it's a very highly vulnerable population. So we do need to make sure that we're looking at it, it's done in a risk-free environment. But when we compare opioids with medicinal cannabis, it's a no-brainer. Basically, the most adverse effect of opioids is death, fatality. So really, what are we arguing about here? We need to be opening the doors to something that is actually going to change the face of chronic pain in aged care. So I'm a very big believer of everybody moving forward, but it's just taking a damn long time, unfortunately, which can be a little bit hard to deal with sometimes, but anything worth fighting for takes time.
How long have you been a nurse for, Leah?
35 years.
Oh my God, I've been a nurse for about 30 years too.
Yeah, right. Old nurses are the best.
Yeah. I think I graduated in about 94.
Yeah.
But I guess I'm the dark side of life because I got deregistered because of cannabis.
Ah.
Really.
Well, they're not going to deregister me because of it.
Why not?
Because I still play the game better than the game plays.
Good. The problem is, you see, in Australia, and this is for every medical health professional that is under the licensing regime, is that we cannot talk to you about cannabis. So right now, I'm just telling you right now, you cannot take cannabis in Australia, heaven forbid, in case the police come and arrest us make this poor lady unemployed. What a ridiculous situation we are in when cannabis was legal in 1930. I know, right? Before everything was propagated and changed on its axis, and the stereotype and the stigma and all the myths associated were fostered by the politicians, where they dehumanised, or not dehumanised, they actually demonised cannabis, and then all of a sudden we have a whole culture, a generational culture that believed that stigma. Right. And this is what we're trying to overcome as well. So Dr. Catlaris, another medical professional, deregistered. Dr. Deb, there's just countless victims here in Australia. Yeah. So you people, just by attending, are very brave. And yes, you may be caught by the police because you are a revolutionary just by being here. Yeah. I really do think
we're creating change.
Give yourself a pat on the back because the government is watching you. But you will change the law because eventually mass movement of people. This is what happened in Canada.
Power numbers.
It was illegal in Canada, but the mass movement of people caused the police to ignore the medical dispensaries. Yeah. Let them just pay their taxes quietly like a prostitute and we won't arrest you. That's how it works.
Yeah, absolutely.
Does anyone here have a burning question about cannabis related to your personal life? Come on. Come up and tell us, or shall I give you the mic?
Maybe that might be easier.
I'll give you the mic.
There you are.
Hi. My name is Jennifer. I was diagnosed with breast cancer in 2014 and then with metastatic breast cancer after being given the all clear in May. On the 1st of, I got the all clear in February 2017, and on the 1st of May I was diagnosed with metastatic breast cancer. I've been through all the standard things. I've actually had a lifetime of good health, good eating, exercise, blah blah blah, so I'm just bloody unlucky. I went to a retreat early last year and talked to some, it was for people living with chronic illness, and spoke to a couple of people that were using cannabis and did some research, and I started using it in May, and like many people I was on very high, because it's in my bones, high levels of cannabinoids. Actually the highest available, I don't know if any of you know about Plexia, but 150 is the strongest one, and that's where I was at 3 times a day. And they dumb your brain as well as you can.
And your question?
Sorry, I was just going to say I found it really, sorry, I'm rambling. The CBDs has enabled me not to use any cannabinoids at all. I've been off them since July, totally. And the cannabis oil I'm using in it's really managed the disease. 12 months ago, you wouldn't believe I'd be able to sit here and drive you on my own. So,
for breast cancer?
Yeah, it's been
and
for
you
me.
took CBD?
And a full spectrum as well.
Full spectrum.
But CBD for pain.
Did you try and mimic a Rick Simpson protocol?
Yep.
Is anyone interested in Rick Simpson?
No. Yep.
Yes or no?
Yep.
You can move on if you know. Show of hands, yes? Sort of. Okay. Very briefly, we won't steal the light from Leah, but very briefly, because we're doing this together.
A question about the CBD.
Do you want me to just pass one quick sentence on Rick Simpson? Rick Simpson is just a man. That's all he is. And as a man, he had, I don't know, melanoma or something simple but life-threatening. And he had access to a lot of plants. And so he made 1 gram of cannabis extract. This is how cannabis began as a medicine, okay? So he took 28 ounces of weed, 1 ounce, which is 28 grams, and he did alcohol, evaporate, cook it, shake it, whatever you do, you can read about it, and he's left with the gooey extract, 1 gram. So 1 gram, you actually get 3 grams out of 28 grams of plant. So 28, that's about $300 street value, and that should last you 3 days. So he took 1 gram a day for, it's 1 gram a day for either, I think it's 90 days. So it's over a 3-month period. And he worked up, he started slow and took 1 gram a day after day 35. And then for 3 months, his cancer got cured. So this is the story of how high dose, full plant extract of cannabis cured him. But that high dose is not for everybody.
That's right.
This is for cancer, severe pain. You can take a lower dose for Parkinson's or arthritis. And Leah, I'll tell you about my family and friends. I've had a friend that had his finger amputated. He was in his 70s. And I had another friend who's just had an operation, laparotomy or whatever. They cut open and removed some organs. Again, in her 70s, scared of the pain and the morphine in the hospital. And so we just mixed it in some honey. And have it on toast.
Yep.
And that helped her with her pain and getting through the day. So it is a pain relief.
Yeah, absolutely.
Some people don't know that cannabis can actually potentiate opioids. So it makes opioids last longer in the body, so you get better pain relief.
Yeah, so I'm not always saying no opioids or no other regimes. I mean, obviously there's a lot of factors that we need to consider with anything that we put into our body.
But you just
and we
less.
also need to know that every single body is different from one another. So what works for you, what won't work for you, but might work for you, but might not work for you. So we do need to look at the individual biological profile of every single person before we give them anything to treat any condition that they live with.
Yeah.
Now when you look at cannabis, yes, you can use it in conjunction with other medications, for instance, and it might complement it.
It does.
So we're not saying you replace one with the other always. Sometimes that will work more effectively for some people. But some people might need to have a more multidisciplinary approach where they have lifestyle changes and nutritional changes and other type of changes to their lifestyle to also complement the use of medicinal cannabis. So once again, it does have to follow a very strict and approach in regards to the individual.
So the point here with elderly, in treating elderly,
and especially elderly people, because they're so highly vulnerable.
recommendation is you start low.
Yeah, start slow, start low, monitor it,
build up,
and actually review it on a daily basis to make sure there's no adverse effects, because no matter what, yes, the adverse effects of cannabis are much less than like our opioids and stuff like that. However, as with anything we put in our body, there's going to have people that might be intolerant. There might be people that are actually allergic to it. There might be people whose endocannabinoid system is stuffed up to the max, because when you get old, a lot of the systems that run our body start wearing out. So we need to know a lot about excretion times and all those type of things with each person to understand how they're going to actually benefit from the use of cannabis. So it's just the same sort of framework that we actually follow when we prescribe anything for anyone. And it makes sense because we want to eliminate risk and maximise the efficacy, always.
And so just complimenting on Leah, because she's raising this point of juggling your medications to get the best combination, cannabis is one.
It is.
If you're taking cannabis, you're going to need less opioids.
Yeah.
Because opioids is working better.
Or none. If they're non-effective at all,
right.
I would be saying people should not be on them because they're actually so destructive to quality of life.
Cannabis is anti-inflammatory, so you can increase your dose.
Yep.
And if you don't want to talk to your doctor about, oh, I'm on cannabis, I'm ashamed because I'm breaking the law, tell your doctor instead something else.
Yeah.
Say, I'm on grapefruit. I take a lot of grapefruit, Your Honour. And how is that going to affect my medicine? Because CBD acts in a very similar way to grapefruit. So if your medication interferes with grapefruit in a bad way, well, then you can think cannabis will be doing the same thing.
Actually, it's funny you mentioned grapefruit because anybody who has high cholesterol and is on a drug called Lipitor to lower your cholesterol should never eat grapefruit because it makes it ineffective. I just thought I'd throw that in there.
And I'll upset everybody in the world now who's going to just watch me on video. Hello. I don't believe in the Lipitor myth. Okay? The Framingham study of a town called Framingham in America showed longitudinally over 20 years that saturated fats and increasing does not cause heart disease. End of story.
Well, it can be genetic.
What causes heart disease is Coca-Cola, sugar, the small cell LDLs, and we can have a whole hour-long discussion on this.
But it's not what we're talking
pharmaceutical
about.
business money-making greedy scheme. Sorry, that's what you are. You're greedy because of you, the pharmacy.
Not you.
I'm pointing to the camera, and whoever's watching. Because of you, I don't have a job as a nurse, doing the work that I love the most. It's all about money, pharmacy.
Oh, absolutely, and I won't go into the big pharma debacle and greed and ego and arrogance because that's another hurdle that we need to deal with in this society at the moment.
Should we hit another question from the audience? Is there someone else? Come on, young lady.
Thanks. Mine is a short one. There is nothing wrong with me at all. And I'm just taking CBD as a precautionary measure, like, stuff like better prevent than cure.
Good idea.
Yep. Does it work?
Well, it's like taking a vitamin tablet. Of course, you're going to ward off a few ghosts, don't you think, Leah?
Expensive urine.
Yes, it's good. I mean, we should all
your body only takes in what it needs. So if you don't actually need it, it excretes it.
It's like eating vitamins.
Yeah, so people that take all of these vitamins to, for prevention, actually excrete, if their body doesn't need those vitamins, it will excrete it all. Okay. It's more about looking at the core root cause of conditions and treating them in a manner. Yes, there's certain things that you can adjust to prevent disease in life, but most of them aren't about taking vitamins and other types of things. It's more about nutrition and lifestyle and hydration and exercise.
I'm doing all that.
Yeah.
Well, so I'll throw in.
And look at you, you're as healthy as anything. That's right.
And you'll probably find that most of our antibiotics come from mushrooms and fungi. In fact, they do, right? They all come from fungi and mushroom stuff. So by all means, eat mushrooms. They're not that magical as you might think. Magic mushrooms. They're actually quite therapeutic. Helps with depression and many other things. Nature provides and we outlaw it. That's what we are good at.
Yeah. Balance.
That's
the dynamic we aim for.
I had a man there come and talk to me on the phone 2 weeks ago.
Yep.
And he said his wife had cancer. I forget exactly which one. I think it was lung. And also secondaries, and he did a Rick Simpson protocol for 2 years. Can you believe it? So for 2 years, his wife was taking 1 gram of extract a day. In other words, an ounce of weed in 3 days. That's a lot for 2 years. And after 2 years, he was on the phone and he was almost crying because he loved his wife. They're married all life. And he said, it's not working, my cancer went away, it's now come back, what can I do that I'm not doing right? And the only thing I could think at the time was to say, you've done everything right. It's not that cancer is definitely going to be cured by cancer, but maybe you have bought yourself with the cancer an extra 2 years of life.
Yeah.
What else shall we talk about? Any other little topics you want to add?
Well,
or should we go back to
I
questions?
was talking about chronic pain in aged care, so that's my thing.
Yes, she's an expert in pain and aged care, so we should be talking about pain. There's another question. Hang on. No, don't yell it out. Go get shouted at all the time. Scary.
Oh, hi, I got here a bit late, but my dad's got dementia at the moment, and I know it's a big problem in our society. And I'm just wondering, how can cannabis be used to help dementia patients?
Okay, I need to make a disclaimer right now. I do not advocate giving cannabis to people living with dementia in any way or form. Okay, I'm concentrating, yes, I'm a dementia consultant, but I'm also an aged care consultant, and so that's why I'm looking at chronic pain, which is a massive area of need. But people living with dementia, my models of care over the years have proven, I mean, what do you want to give it to them for, number one? No, there is no evidence at all in regards to cannabis curing dementia. There is no cure. I sat down with Raphael Meshulam last year and discussed it with him, and he said there is no cure.
Who is Raphael Meshulam?
Does everyone know who Meshulam is? He's the godfather or the grandfather of cannabis, and he's an Israeli man who did the very first studies in the 60s in regards to the healing properties and therapeutic benefits of cannabis. So he's known as the big man. And I had the privilege of spending a day with him at Jerusalem University and discussed this very topic with him. And he said that there is no evidence at all at this stage, because we've only scratched the surface. We've got to remember that. We're just, just scratching the surface here. There is no evidence at this stage that cannabis in any way reverses progressive brain injury like Alzheimer's disease. Now, the other thing we need to look at is there's 170 different types of dementia, so what type are you talking about? When they talk about neurological pathways, that's only one change that occurs amongst 100 changes that occurs in a brain, like with someone with Alzheimer's. So what about all of the proteins that develop around the discarded cell material? What about all the tangles that occur in the nucleus of the cells? So just healing neurological pathways does not cure dementia. So we have to be very careful about false hope. And so at this stage, no, we would not be giving it to such a highly vulnerable group of people, not only because of the fact that there's no evidence, but also because these people live in a state of progressive brain decline every minute of every day, in a different reality to us, have a lowered stress threshold. So actually placing them at such high risk of acute delirium, increased confusion, increased anxiety, increased agitation, it's a no-no. So that's why I concentrate on pain.
Yes. But I'm still going to be the devil's advocate, Leah, and I'm still going to be against you on this point.
You can be, because you won't win.
The subject here is that if you did a Google search, you can see with
Google?
rats...
Are you telling me a rat can be compared to a person with dementia? No, I'm sorry.
No, we can't. Okay, so I support...
They don't even live
Leah.
as long as we do.
I support Leah. But there are some studies which suggest you don't want to get a dementia
Be very
person
careful about how you talk about people living with dementia in my room.
You don't want to get them more confused.
No, you don't.
But there is some studies which show that taking CBD reduces the release of a particular protein, a metalloid protein, I think it's called, and so that can reduce the progression of dementia. So it's early science. I find it hard to believe that your brain is saturated with CB1, CB2 receptors. It's all up in the brain mostly, and it helps with epilepsy and memory loss and many other diseases uses, so surely it has a benefit on dementia.
What you have to understand with dementia is once that brain cell is destroyed, it does not come back. It cannot regenerate itself.
So we can slow it down.
No, we don't slow it down. What people are getting wrong
with cannabis
is when you look at somebody with a progressive brain injury like Alzheimer's, because I'm going to talk about Alzheimer's being the most common form of dementia. Like I said, there's 170 different types and they all work differently on the brain. So once again, you need to look at the individual here. But with Alzheimer's, it's progressive and it's global, and it starts on the outside of the brain and it works its way in and it destroys every single brain cell. All the spinal fluid that runs between your brain dries up, and then there's like 50 to 100 different other changes. Yes, it affects short-term memory. Yes, it affects people's stress thresholds, etc., etc., etc. They start losing skills, they start losing their abilities to maintain life on a normal level. However, a lot of that is impacted on by other conditions. So if you actually alleviate those conditions, for instance depression, acute delirium, pain, all of a sudden those people seemingly go back and their memory improves, their cognition improves. And you don't have to give them anything to do that. You just actually have to understand what is happening to their brain and understand the triggers to those type of issues, remove those triggers from their lifestyle, and they seemingly blossom in front of your eyes and start thriving again, and their memory improves and their cognition does improve. And people say, oh, it's because of this, this and this. No, it's actually more about alleviating those other conditions that are exacerbating the symptoms of dementia. And there is actually no proof that, and there is no drug that slows the progression of dementia. What we have to do is develop models of care that allow people living with dementia to continue living their life as they know it, and stop actually basing our understanding of the disease on our subjective assumptions and fears about dementia. We can only actually care for people if we understand it through their eyes. And then we can create a lifestyle for them in which they actually continue to live well. And, you know, I write a lot about chemical restraint. I write a lot about eliminating the need for any medications for people living with dementia, because I've proved by my research that that is the way for them to continue living their life well, and it actually slows the progression down because it's not actually being exacerbated by all of the other age-related conditions that they live with.
Alright.
That's a bit of a long-winded, but there's a lot more to it.
Comprehensive.
But yeah.
Thanks, Leah. Now we've got another audience comment.
I actually wanted to support everything that you said, because my dad died of dementia and we inherited him when my mum died.
Yep.
And he was very ill then already. He was sleeping 16 hours a day.
Yep.
He did not eat. He was totally non-coherent.
Yep.
And then what we did, we were at that time we were on raw vegan diet.
Yep.
And he automatically went to it. Within 1 week he was off his tablets for depression.
Yep.
And he had 10 years of depression beforehand.
Yeah.
And then he bounced back. He did not sleep for 16 hours a day, which was a little bit...
Yeah.
And he declined very slowly. He had 2 years of excellent health.
And this is it, right? People have got the care model wrong.
Yeah.
And I also, just to actually add to that, is that a lot of people living with dementia, we have to remember that, at a certain age we are living with a lot of other conditions, but people just focus on the dementia, don't they? And they don't focus on people's actual strengths anymore. They just look at the weakness, and we actually create the suffering for a lot of people living with dementia because of our attitudes and the stereotypes associated with it.
Okay. We have another comment here on dementia, Leah, if that's okay?
Sure.
Right.
I was actually planning on asking a question, but you've already answered it, so I'll just comment. Late last year I met a lady at a workshop she's looking after her mother with dementia.
Yeah.
And she started to give her CBD, and although, as you say, it hasn't changed the dementia, it has dealt with the high level of anxiety that the dementia has caused and given her back her quality of life.
All right, I'm going to reply just quickly to that before you go any further. Do we not all exhibit behaviour when our needs are not met? Do you get anxious when something doesn't go your way? Does someone medicate you for that?
I'll come on.
I think that anxiety needs to be dealt with, especially when you're talking about...
But if you understand the mindset of a person living with dementia, you can eliminate the triggers to that anxiety.
Not completely. I work in aged care and I have a lot of clients who have dementia, and there's often a level, like a high level of anxiety
There is often,
that goes along with
but that becomes a situation where staff are not trained adequately, because I ran aged care facilities for people living with dementia for 25 years, and I would take only people with advanced dementia who were so-called unmanageable. And I won a global award for actually eliminating all behaviour in all 50 of those unmanageable people within 12 months, and eliminated the need for any medication or chemical restraint whatsoever.
I don't work in residential care. I don't work in residential care. I work with people who are still living at home.
Yep, and I work in the community as well.
So in many cases they're living alone and their anxiety is high. And if we can support them by giving them something such as CBD, it does improve their quality of life.
Absolutely. And, you know, there are going to be circumstances, like I said, it's always going to be based on the individual, where they might have other conditions that might be causing that anxiety. They might have depression superimposed on the dementia, which means that their anxiety levels are going to be higher. So maybe by actually alleviating the depression, we alleviate that anxiety. But it's going to depend on the individual. Acute delirium is also a serious problem because it makes those type of behaviours seem worse, because someone's acutely delirious, they're bouncing off the walls with confusion, and then people just go to the trolley and just keep drugging them up. But I actually started getting a lot of emails from people in the States, because what they were doing is they were told, my dad's got Alzheimer's, give them CBD, or give them CBD with THC, or whatever it was you get over in the States. And what was happening is they were ending up in emergency, acutely delirious, psychotic episodes. So that says to me how careful we have to be, and how we have to have a very healthy respect for people that have any condition that affects their brain. Yeah.
Oh, we've got another comment here in the audience.
Talking all about dementia now instead of pain in aged care.
I know, it's a very hot topic here.
Yeah, I know.
Personally, I don't take any judgments. You know, if it works, it works. If it doesn't, it doesn't. God knows, when I'm old, if I have dementia, I would love to be stoned as well. But that's just a personal comment.
If that's part of your care plan, I've already written mine. If that's part of your lifestyle and who you are, then that should be carried on into your life living with dementia. That's the whole thing. It's all about continuing life as that person knows it. So if they've always had a spliff before dinner, absolutely, that will continue. It's just like if an old man always likes to have a couple of scotches before he goes to bed. Who are we to say, no, you can't have that now that you've hit a certain age because we're in charge? So basically, it's about continuing their life as they know it and not changing it, because change then triggers acute delirium all over again with people living with dementia.
So I think you were talking about whether or not cannabis is an effective treatment for dementia or other degenerative mental illnesses. I think it's kind of
dementia is not a mental illness, it's a disability. Okay, it's not considered mental illness or a psychiatric condition.
I think there's big
difference.
Okay. My comment was that it's kind of a moot point as to whether or not cannabis is effective, because there's already LSD or psilocybin as an effective treatment. That can even be shown to regenerate neurons.
Can be, potentially could be, maybe. They're all the words that are in all of those researches. None of them are definitive. I don't go with can be's and maybes, especially with people that are so highly vulnerable. But yes, I've also heard that as well. We're winding it up. Didn't talk much about pain, did we? Did that yesterday, so whoever wasn't here yesterday would have heard me talk all about pain in aged care.
We've got 2 more questions, and then we're going to have a little adjournment and have some lunch and come back in half an hour, okay? So 2 more comments by the audience.
Any comments or any questions about pain, maybe?
Yeah, about pain management with cannabis. I was curious about changing people's perception around cannabis.
Yes.
Because a lot of the people that you're
absolutely working in the medical field, especially very conservative, very rigid, and so I'm actually working at the moment with Professor Ian Brightoak from the National Institute of Integrative Medicine, and we run seminars 4 times a year for medical practitioners. And we teach them everything there is to know about cannabis. So then we're equipping them with the skill and the understanding to be able to prescribe with confidence to all of their patients. Because we've got to start there. They're our strength, because at this stage it still has to be prescribed. So we need to actually help them understand it, because they don't learn it in medical school. They don't get given any information on it, so they're going with the flow with what's based on the media, Googling it or finding out as much as they can, but a lot of it is based on stigma and stereotype and institutionalised bias, as we know. So what we're doing is we're actually doing a 3-day course where they get points after, which are called CPD points, which are actual points that medical professionals get to show that they're doing constant upskilling and knowledge, learning of knowledge, etc. So we're actually doing that on a regular basis, and each seminar we do, we're getting more and more GPs interested and on board, and that is growing the power that we need to create change, because we need them as well to create this change. We need our advocates, we need our patients, we need, everybody that has something and believes in this, without a doubt, is going to be beneficial, and looking at the patient, putting the focus back on the patient, and looking at it from a humanitarian, empathetic and compassionate viewpoint. And that's what doctors are about. I mean, the Hippocratic Oath is do no harm. So therefore, if they're in it for the right reasons, they're actually educating themselves, and we're educating them so that we get them on board as well. And so, we're working towards that as well.
What about the perception of the patient?
So once again, there's so many things that come into that. We've got all of the backflow from the reefer madness in the 1920s or 30s or whenever that was, and that's people still hold on to that, don't they? They misinterpret what we're looking at as medicine to the street version of cannabis. They think that we're suggesting that all these people should be sitting there, but they're not understanding that we're looking at a regulated medicine that is going to meet specific conditions where other treatments are ineffective. To not actually honour that oath to actually care for people and our duty of care, not to do that is considered gross neglect. And you can't condone that. In this day and age, if we can send people to the moon, we should be able to alleviate people's suffering. And if there's an alternative there waiting for us that we know about, we can't keep denying it. And so the public also needs to stop listening to a lot of the crap that's fostered by the media, because that's all about sensationalism. And so they're only going to talk about the negative. And so once again, providing education to the whole of humanity, but the community, medical professionals, allied health, everyone, we all need to get involved so that we can move forward into a future where the next generation don't have to fight this fight. They shouldn't have to be questioned on using something that benefits them and treats their condition, whatever it may be. So there's a lot of hurdles, but we are overcoming them.
Okay, Leah, last comment.
That's it.
Last comment by this audience. Last comment, and then we're on.
Do I know you?
Hi, my name's Sarah Jane. I'm a registered.
This is one of my oldest friends.
And I used to work with Leah. She's always been my mentor, but I moved up here about 6 years ago, and I work in the community. My passion is palliative care, and I was a community palliative So I have seen first-hand
Yes.
and worked with hospices,
Yep.
with hospitals, and also experienced clients dying but with less pain.
Yeah.
And I just see it every day, the people that have benefited from it. So I'm here to get more education. I think we all need to get on board.
We do.
Because we all need to understand. The doctors need to be educated more than anyone else.
Yeah, because it's not a blame game.
Well,
it's actually been fostered by society. I mean, and all we can do is stand up and advocate for what is right. I mean, it's logical. And once you strip away all the emotion, it's logic that's going to stay, and that's what we need to look at.
I know, but the doctors also need clinical trials.
And they are, that's exactly right. And that's why we're working on that too.
Because they're prescribing because they don't know the contraindications.
And they don't know what to prescribe.
With their own pharmacy.
Yeah, but they haven't been given the education into the science behind
I know.
it
They just
either.
prescribe
So
something
they don't know what they're prescribing. They can't just say, oh, we're just going to prescribe one fits all.
No.
They actually need to look at the root cause of whatever ailment somebody has and have the specific product that's actually going to meet that person's needs and do it in a way that is going to allow that person to have their symptoms alleviated. I mean, it's common sense, but we need to actually get out there and keep up the education. I mean, both my parents died from cancer, and I can't tell you, I've never felt so helpless in my whole life because I wasn't able to help either of them because it was a long time ago, and I couldn't help their pain. And as a nurse, I don't think I've ever felt so useless in not being able to alleviate that suffering for the two most people that I care most about, let alone all the people I've cared for over my 35 years in the medical industry. It's the one thing that just keeps popping up. People live with pain every day and it ruins their quality of life. It's cruel. It's inhumane. It has to stop.
Thanks very much.
Thank you.
Well, I think we're going to wind it up there. I can see people who want to talk.
Yeah, because
so
I've got to catch a plane, guys.
Yeah, so catch Leah as she dashes out the door.
No, I've got to dash.
Catch her as she's running out the door.
Thank
Big
you
hand
for your
for her.
attention.
Thanks, Leah. You're a gem.